most vulnerable citizens in Pennsylvania, our grandparents, our seniors. And today we're honored to have the Republican whip and the ranking member of the House Select Subcommittee on the coronavirus. He's going to join us today to talk about the important work of his subcommittee. He's also in this work been interested in ongoing proceedings around the country, but in particular in Pennsylvania and some of the things that have happened here. As you know, as of today, there are at least 4,539 COVID-19 related deaths associated with Pennsylvania nursing homes and long-term care facility. Now, in case you did know this, that represents a 70% of the total deaths due to COVID-19 in Pennsylvania, 70%, and 3% of the nursing home, elder care, assisted living care population in Pennsylvania have died due to COVID-19. Sadly, as of the latest count, our state has lost 6,649 residents to COVID-19. Now, one of the things that we knew at the onset of COVID-19 in America, there were a lot of questions, arguably, but one of the things that we absolutely knew for sure is that the virus disproportionately affected seniors and individuals with pre-existing medical condition. And while we knew very little, what we knew about our most vulnerable populations were our elderly, including residents in nursing homes, personal care, and long-term facilities, were particularly susceptible to this. And so one of the questions I think that we all reasonably have is why, if that is the case, would we have a policy that would expose that very vulnerable population to this virus? And the question is did that policy result in the untimely and unnecessary deaths of thousands of elderly citizens unnecessarily? Now, the timeline kind of goes like this. On March 13th, the Federal Center for Medicare and Medicaid Services, or CMS, issued guidance that was the blueprint for individual states to follow when determining how best to control outbreaks. In no place in this guidance, and this is important to highlight, in no place in this guidance does it direct any nursing home or facility to accept a COVID-19 positive patient if they're unable to do so safely. So for instance, and let me just clarify this, if you have a small facility and maybe the minimum situation is 2 people per room, or maybe 4 people per room, and you only have 1 floor, then you can't be accepting COVID-19 positive patients because you don't functionally have any way to isolate them, if that is what your facility is, how it's laid out and administered. So for those who can do so, then there's a way to do it. But for those that can't, there is no way to do it, yet they were still required to take these positive COVID-19 patients. The guidance stated that nursing homes should admit any individual that would normally admit to the facility, including individuals from hospital, where a case of COVID-19 was or is present, only if a nursing home can follow CDC quarantine guidance. Now, I talked to the CMS administrator, Seema Verma, and she said under no circumstance should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs in accordance with the guidance. CMS did not mandate COVID-19 positive patients back to nursing home. Yet only 5 days later, after the CMS guidance on March 13th, the PA Department of Health issued guidance that said nursing care facilities must, and that's the critical term, must continue to accept new admissions and receive readmissions for current residents who have been discharged from the hospital. The critical difference between the federal guidance and that of PA Department of Health is its mandate. In policy and regulations, there are critical legal differences between the words can, should, and must. And that is something that I've been attempting to work with the governor to address so that together we can all do their best to protect our most vulnerable. Unfortunately, my letters and outreach to the governor have gone unanswered. On May 12th, I sent a letter to Governor Wolf asking that the March 18th guidance be revoked. On May 14th, we sent a request to HHS Office of Investigations to immediately open an investigation into Pennsylvania's COVID-19 nursing home guidance. On May 28th, we sent a letter with Rep. Keller to Secretary Levine asking for action to protect our most elderly populations. And on June 25th, I joined the Republican Pennsylvania delegation in the House Select Subcommittee on the coronavirus on a letter to PA Attorney General Josh Shapiro asking for an investigation into the governor's COVID-19 nursing home policies, which, by the way, still remain in place to this very moment. None of us wanted it to come to this, and we are devastated about the tragic losses in our community. But until we see the dangerous policy reversed or revised significantly, I and those who see what's happening remain unwavering in our fight to protect our most vulnerable citizens. Now, with that, I'd like to introduce my guest today, Representative Steve Scalise, who represents Louisiana's 1st District. He is the House Minority Whip and is currently serving as the ranking member of the House Select Subcommittee on the coronavirus. As the lead Republican, Whip Scalise is leading the charge on bringing transparency and accountability to the federal and state response to COVID-19. On June 15th, Whip Scalise led the committee in sending a letter to Governor Wolf and 4 other governors, New York, Michigan, California, and New Jersey, requesting answers as to why the governor ignored federal guidance and put into place a mandate on nursing homes. And with that, I would like to turn it over to Whip Scalise.
Well, thank you, Scott, and really good to be with you. I appreciate your leadership on trying to dig and find answers in the state of Pennsylvania. This is something that we in the Select Committee started looking into really when we were looking across the board at deaths from COVID to say, you know, what do we know after over 2 months of this disease being in America? People have been dying all across the country. And then we started seeing disparities in different communities. It wasn't affecting everybody the same way. Young people weren't being adversely affected. And so as the data became more clear on deaths, we wanted to find out exactly what was going on based on what we could find out. And what we saw was that the largest disparity was amongst seniors, especially in nursing homes. And so I wanted to dig deeper into that to see if we could find trends, if we could find best practices, worst practices. Was it happening equally across the country? Unfortunately, what we found out is that the largest percentage of COVID deaths amongst seniors in nursing homes were limited to 5 states. And it was 5 states who decided to go a different direction than the federal standard, as you pointed out. As you spoke to Seema Verma, the head of the Centers for Medicare and Medicaid Services. They're the agency that helps dispense the funds for nursing homes. As you know, nursing homes are regulated at the state level. So each state has their own protocols for nursing homes. But what the federal guidelines out of CMS said were, under no circumstances should you send a COVID positive patient from a hospital to a nursing home that's not able to properly isolate and take care of that senior in the nursing home setting. Under no circumstances. 5 governors threw that in the trash can and said, we're going to do it anyway. Unfortunately, Governor Wolf, as you know, was one of those 5 governors who issued a different order out of his health department saying the hospitals have to send them back and the nursing homes have to take them, even those nursing homes who were not capable of properly handling them. And this is where it got to the area where we started getting the attention. Our staff really dug deep into this to say, well, why would 45 governors get it right? Republican and Democrat, by the way, this isn't a partisan issue. You had Republican and Democrat governors in 45 states follow the federal guidelines. In every state, we had nursing home deaths, and we mourn each one of them. But we saw dramatic differences in how each of the 5 states that went their own direction experienced deaths. Pennsylvania, for example, there were 300% more deaths from Pennsylvania nursing home residents than in, for example, the state of Florida, where they have a high percentage of people in nursing homes in Florida. But the governor of Florida followed the federal guidelines, had dramatically fewer nursing home deaths than Pennsylvania because Pennsylvania went their own direction. We're talking about 4,500 plus people who died in nursing homes in Pennsylvania. And Scott, as you know, this isn't an equal number. 68% of all Pennsylvanian deaths from COVID were seniors in nursing homes. These were alarming numbers when we look nationally. Across the country, we've seen that about 42% of all American deaths from COVID, all American deaths, came from seniors in nursing homes. And this should be alarming for a lot of reasons. There are our grandparents, our parents, but it also represents, by the way, seniors in nursing homes represents about 0.6% of the American population. So when you think about that, as we were digging into this, what really struck the most was less than 1% of America's population accounted for over 40% of our COVID deaths nationally. And that's why we started digging into this in the first place. What was really the thing that angered us so much was that when we dug into these 5 states to see that they accounted for the largest percentage of all the senior nursing home deaths in America, is that so many of these were avoidable. If Pennsylvania would have just followed the federal guidelines, if the state of New York and New Jersey and Michigan and California would have followed the federal guidelines, thousands of seniors would be alive today, instead of when you saw them being forced back into the nursing homes where they couldn't take care of them. And it wasn't just that senior who was then at risk, it was every other nursing home patient, because they weren't able to isolate them. So they're in group settings, they're eating together, spreading this disease. As we know, the disease spreads. The most vulnerable population are our seniors. And these governors, including Governor Wolf in Pennsylvania, forced the nursing homes to take seniors who were COVID positive from the hospital back into the nursing home, even knowing that they couldn't properly take care of them. It was a death sentence for thousands of Pennsylvania seniors. I appreciate that you're digging into this. I've asked the governor and the attorney general of Pennsylvania to investigate this. The governor refuses to give us data now, by the way. There's a lot more that we don't know than we do know, because the governor of Pennsylvania is hiding some of this data. I don't know why he's hiding it, but I'll tell you, this isn't just us asking for these answers. The families who died, the families of these seniors in these nursing homes who died, want these answers and deserve these answers. I'm glad you're fighting for them. I'm fighting for those answers as well. And we're not going to stop until we uncover this and stop it from happening again as well.
I guess maybe I was muted there. Yeah. Let me see here. I appreciate your willingness to be in the fight on this. Of course, you're leading the charge from the task force there, and you're seeing what the differences across the country very acutely. And so you can see what policies work and what don't work. And our interest, of course, is to make sure that we have the best policies to keep our people, our citizens, healthy and certainly alive. With that, one of my concerns is, of course, and you're struggling to get information out of our governor and the Wolf administration, is that until we raised the issue, they were only reporting, because of the way they reported it to the public, only about 40%, which is high enough. 40% of Pennsylvania's deaths were in nursing homes. When we raised the issue, they actually looked at their own spreadsheets and said, and they could do the math too. And that's where we realized that and they tend to agree with us now, it's more like 70% of our deaths in Pennsylvania are due to nursing homes. And so what we're looking for is transparency here, and we're looking for the rationale that drives this policy. Again, as you know, Mr. Whip, New York already rescinded this policy, right? But it still remains in place in Pennsylvania today. And so that's very problematic. It's like we're not learning from mistakes. We're not learning from the past. We're not learning from the things we didn't know that we do now know, and people's lives are still in peril. And so
and there's no excuse for that, Scott. And this is what's would anger so many people. And you could see it in New York. Governor Cuomo did this for 46 days, and the federal guidelines came out before all of this started and were clear. The nursing homes were saying this is going to kill people, and they did it anyway. They ought to answer for that, but they surely shouldn't hide the data, because look, the whole state of Pennsylvania, almost your entire economy was shut down. And if 70% of the deaths all came from less than 1% of the population, you can learn from that to, number one, limit the number of deaths, but also to help other people get back about their way of life. And students can go to school in the fall while you protect seniors. And instead, the governor's doing the opposite to try to cover this up. I mean, there's no excuse for that.
Well, and to add insult to injury, Steve, as well, you and I voted in favor of supporting the COVID-19 response in a number of different legislative actions, sending money and resources to the states. And then we find out that these resources in the way of PPE, especially facilities, caregivers, et cetera, never make it to the nursing homes. They never get there, yet the mandate requires the nursing homes to take these positive COVID-19 patients. And then the absolute worst gut punch is then Pennsylvania's Attorney General implies that he's going to prosecute the nursing homes for murder. They don't give them the resources. They
Right.
force them to take the positive patients, and then they're going to prosecute them for what happens. It is just outrageous. And so,
Right. And I understand there were articles of impeachment in the state legislature brought against the governor in part for this scandal with the nursing homes. And they're sending these patients COVID positive from the hospital back to the nursing home, knowing they can't take care of them. It's not only infecting other seniors at the nursing home and killing seniors at the nursing home, it's also infecting some of those very workers that they're now going to try to go after. Can you believe that they're even trying to do this? Just admit what you did, be honest with the public, give us the data to help us save more lives, by the way, to help the rest of the economy in Pennsylvania reopen safely while you address this problem and stop it from happening again. That's what they should be doing.
there's just absolutely no doubt about it. And when I talked to Administrator Burma, when she said she issued the guidance, or the CMS issued the guidance regarding reporting and compliance back in March, she told me that Pennsylvania fell in the very bottom category of compliance with that. And so it's really hard to determine whether you're doing the right thing, whether it's working or not, if you don't have the information. And unfortunately, that goes to mismanagement, and people need to know if, while their loved ones were shuttered in these nursing home facilities, and literally they couldn't go to see them at all.
Right.
And they might be having their last final moments, and they still couldn't visit their loved one. Yet the nursing home was required to take in positive COVID-19 patients. I've talked to nursing homes that have since received threatening letters about reporting, not even implying that they're not reporting timely, but if they don't, that they will be sent to jail. And no one's even looking at this policy that has created this whole debacle. With that,
Right, Scott.
I sure appreciate your efforts. And your
Look,
shining
I'm
light
glad
on
you're
this.
on this. We cannot let up. We have got to get answers on this. The governor's got to come clean because people are still dying. We need to get to the bottom of this, and these families deserve answers. Thank you for fighting for those families,
Well, I
Scott.
appreciate it. And I'm hoping that some of the folks that are on will have some questions for you specifically, Mr. Whip, because you are the ranking member on the task force, and you're seeing the events that occur around the country and have a broader perspective than maybe anybody else would. Laura, do you know if we have any questions yet from the folks that are listening in?
At this time, if you are a member of the media and have a question, we will take them. In your participant panel, raise your hand to indicate that you would like to ask a question. Our first question is going to be from David Wenner of Penn Live.
Hi, David.
Yeah, David, are you there?
Yeah.
David,
Hi,
you may
David.
have to accept the prompt to start your video or your audio.
Okay.
I can hear you,
Can you hear me
David.
now?
Yeah.
Okay. And hey, this is for Scott. Scott, are you aware of any examples of facilities in Pennsylvania being forced to take people that they said that they were unable to take care of?
Well, the facilities, I don't know that they called me directly with saying, we have a patient we're being forced to take and we don't want to. They received the guidance, and in the rush of just dealing with the issue, and probably in many cases, this was a resident of theirs that had gone to the hospital I have talked to nursing homes that had sent their residents to a hospital for a routine test or something like that, who then came back COVID positive. I have talked to them about that. So, but they just knew what the guidance is. The guidance says that they must accept them, no exceptions. And so they just dealt with that the best that they could.
Where should those people have been sent?
So that is up to that would have been up to the governor to provide some option, and the Secretary of Health. It's my understanding, in talking to members of the Pennsylvania legislature, that options were offered, including setting up temporary hospital facilities for COVID-19 patients in particular, to relieve not only the hospital facilities but the elder care facilities from that burden if they were overwhelmed with it or could not handle them adequately. Those offers were rejected out of hand.
And that's what a number of states did who followed. Again, 45 states followed the guidelines that CMS sent out. So you can go and see, and I've used Florida as an example because I think a lot of people know they have a high percentage of seniors, and yet they had really good protocols where they said, in fact, they explicitly said a nursing home cannot take a COVID positive patient back from the hospital if they can't properly isolate them. So what some nursing homes did is just set up isolation units, but the ones that couldn't, and there were a number that couldn't, they worked with them to find other accommodations, whether it's keeping those seniors in the hospital or finding somewhere else for them. But they made other accommodations and had a dramatically lower death rate in their nursing homes than these 5 states that went against the CMS guidelines.
The next question is going to come from Ed Mann of the PA Post.
Hey, Ed.
Hey, thank you for doing this. I appreciate this. And I do plan on filing about this, but I also wanted to ask you a question while I have you here. There's been some news reports. Just wanted to ask you, how should the U.S. respond to intelligence assessments that say Russia put bounties on the heads of U.S. servicemen? The AP reported that one of the servicemen that's being examined is from your county, Benjamin Hines. So I just wanted to ask you about, how should the U.S. respond?
Well, Ed, I'm certainly happy to answer your questions about that, and I'll answer this one, but I would hope that we could stay on this subject while we have the whip and the ranking member on the task force here with us. But look, the U.S. needs to respond by first verifying the information, right? And we don't go accusing individuals or other countries of nefarious and horrific actions that are unverified. And right now, as of this moment, as far as I know, DOD rejects and does not have any information to corroborate the claim, and the intelligence agencies are also they can't verify, or at least some of the intelligence agencies are in conflict with that claim. And so until said time, what needs to be done, of course, is that we need to verify that information and then figure out how we're going to proceed. Of course, the fact that one of our own local hometown heroes and service members may have been involved in this certainly brings the issue right home to us and makes it very, very real. But the other concern, quite honestly, is, and I think we should be outraged about this, is that someone would leak this for political purposes and imperil the possibility of ever finding out if this is true and then finding out who's responsible for it. That might have all been compromised now because of the political quest to damage the political rivals. And that is just, that is unacceptable. And we should also, while we're looking at and be thinking about, is this true, and verifying that, and then if it is true, dealing with that, we should also be vigorously seeking to find out who leaked this classified information and prosecuting them for that as well.
Well, and that's an important point, Scott, because first of all, if it happened, obviously we need to take decisive action. And President
Absolutely.
Trump's got a strong record of standing up to Vladimir Putin, unlike the previous administration. You can look at his actions in Ukraine when the Obama-Biden administration would not help Ukraine stand up to Russia when they were coming in with tanks. President Trump turned around and said, I'm going to sell you those tank-busting missiles that Obama and Biden would not. And that pushed the threat of Russia out of Ukraine, standing up for an ally. The Russian interference in our election that happened under the Obama-Biden watch that was allowed to go on during their watch, President Trump took decisive action, sanctioned Russia, kicked out diplomats, and has taken strong action to protect our elections today, unlike what Obama-Biden did last time. But on the point of the leaker, again, we're going to get to the bottom of what really happened, but it's going to be harder now that somebody leaked. And not only did they break the law in leaking, they tipped off the Russian government. Now they've given Russia a head start to go destroy evidence by illegally leaking this information, which makes it harder not only to find out if this really did happen, but it also tips off Russia so they can go destroy evidence. These people need to be rooted out, because we've seen a lot of false leaks to try to set a false political narrative, only to find out later that that leak wasn't accurate. But in the meantime, it puts Americans' lives at risk to have these illegal leaks. President Trump has had a strong record of standing up to Russia. Finally, after the Obama-Biden reset, where they literally let Russia run roughshod over Eastern Europe and other allies, while undermining our national security. So I'm glad President Trump is standing up to them, and we'll get to the bottom of this.
Absolutely right. Absolutely right. What else you got for us, Laura?
The next question comes from Zach Hoops of the Sentinel.
Hey, Zach.
Zach, you there? Maybe you're on mute. There we go.
Can you hear me now,
Zach,
gentlemen?
we can hear you. Yeah.
You can? Okay. Hey, thanks. Thanks for doing this. I have one on-topic question, then one off-topic question. The on-topic one, just to clarify, in your letter talking about the 5 states with the higher impact in nursing homes, could you clarify what exactly, what statistic that is based on? Is that percentage of the total nursing home population that was infected, percentage of the total nursing home population that died? What numbers are we talking about here?
Yeah, there's a lot of data out there now. Of course, you have total deaths in each state, and then what percentage of that state's deaths are people in nursing homes, the deaths per capita. What we saw is when you take the 5 states that went against the CMS guidelines, there was a dramatic increase in those states. And I'll take, again, Florida versus New York, for example, or Florida versus Pennsylvania. There were multifold increases. 300% more seniors died in nursing homes per capita in Pennsylvania than in Florida, who followed the federal guidelines. Of course, Pennsylvania did not. In New York, it was closer to 900% more seniors in nursing homes died than in Florida. And of course, one of the challenges is we're having a hard time getting the data from Pennsylvania and from Florida and from Michigan and from New Jersey and from California. And these governors have started stonewalling as we've dug into and found this scandal out, because they don't want people to see the full picture. So it makes it harder. Governor Cuomo, for example, the other day was asked why he's not giving us all the data. And he said, well, we had more deaths in nursing homes because we had more deaths in New York. Well, of course, New York had more deaths because they violated the federal protocols. They would have had thousands fewer deaths in their nursing homes. Pennsylvania would have had thousands fewer deaths in their nursing homes if they would have followed the federal guidelines. And again, you can look at the percentages of nursing home deaths in those other states. Every state had deaths in different categories like seniors in nursing homes, but they were dramatically lower. And I'm talking hundreds of percentages lower in the states that followed the CMS guidelines.
And Zach,
and that
it's hard
equates to probably thousands of lives that would have been saved in Pennsylvania if they would have followed those guidelines.
Yeah, Steve is absolutely right. And what's frustrating for us is we're trying to figure this out so that, let's face it, we all want to do a better job. Our job here regarding coronavirus is to keep our folks safe and healthy. And that's why we embark on the policies that we embark on, whether at the federal level or the state level. And it should be pretty obvious, especially where you are, Zach, in Cumberland County, where, look, I don't know what the number is exactly now, but at some point, not too far in the recent past, 90% of Cumberland County's deaths occurred in their nursing homes, 90%. So there's a reason for that. And we're trying to figure out what that reason is so that we can do a better job. And of course, it makes it more difficult when, for instance, for some period of time, actually, I think until we brought it to light and looked at the governor's information, they were counting deaths that emanated from a nursing home but occurred outside the nursing home. So you got COVID somehow in the nursing home, you went to the hospital and you died in the hospital. You went back home to die at home and you died at home. They were not counted as nursing home related deaths. When we added those up with the ones that what the administration was reporting, it came up to about where it is now, almost 70%. And just a few days later, the administration started reporting it that way because it reflects the accurate picture. And look, we're asking the administration to be transparent and explain the rationale for their decision to not follow the federal guidelines, and so we can understand that and know what the consequences are, so that we continue to learn from this and continue to refine our policy so it best reflects the way to keep our citizens safe and healthy. But we can't do that if they're not going to cooperate.
And by the way, I'm hearing from families in Pennsylvania who are angry about this, and they want answers. They haven't been able to get them from Governor Wolf's administration. They deserve answers for their loved ones who died, and they don't want it to happen again either.
Yeah. Is there something else, Laura?
Hello, do we have another question on that?
Yeah, Zach, did you have another question, you said? Okay, we will move on. So again, if you have a question and a member of the media, please raise your hand to indicate that you have a question. We have one more from Ed Mann.
Thanks again. And so Secretary Levine, she disputed the characterization that thousands, this likely contributed to thousands of deaths in Pennsylvania. So one, just want to ask you, just how do you directly draw that number? And also she says that if you look at the correlation between the number of COVID cases in the community to the nursing home, it's largely driven by the community's, community spread. Just your reaction to her comments.
First of all, look, we're using their numbers. We don't have any of our own independent numbers, and it's been difficult to get accurate reporting data out of the administration. But for the secretary to claim that somehow, we're making up, they are the administration's numbers. We're just actually reading them. And if there's something that we're misreading directly or specifically, I would ask the secretary to enumerate that, because we want to be correct about this as well. But on the onset, as you know, when I had written an op-ed about this, the governor's office and the secretary had called establishments like yours asking you not to run my piece because it was inaccurate. And then after the fact, we were asked or made to prove our position regarding the federal guidelines, and we did that. And it's indisputable now. The secretary can disagree all the secretary wants to, but the facts are the facts. The language is the language. Nothing in the federal guidance requires the states to mandate that their nursing homes and elder care facilities take COVID positive patients. But the Secretary of Health in Pennsylvania's guidance says must. It says must at this very moment, unless something has changed in the last 24 hours. And that remains deadly to many Pennsylvania seniors. And that's a reflection of their policy. If they don't want to own it, I get that, but they need to discuss that and be transparent about it. And hiding from the public and just disagreeing because you want to without backing up with any facts is irresponsible and unacceptable. Just like the whip said, just like Steve said, not only is he hearing from Pennsylvania families who have lost their loved ones, but we're hearing about it. We're elected and we are representatives of our citizens. They're our bosses, and they demand action, and they will not accept, nor should they accept, well, that's just the way it goes and you got to take it because we say so. That's not how this system works. That's not how it's designed to work. And we're not going to accept that.
And let me walk you through what we found when we were doing this investigation. In every state you can find 50 states had nursing home deaths. What is not alike is the percentage, and especially when you look at hospitals that had large numbers of maybe double digit or more deaths in the same nursing home, because what they would do is in any nursing home like anywhere else, if somebody was getting sick that was a high risk person, they would send them to the hospital. They would test them. If they were testing positive, this is where the difference came. CMS said if they test positive and the nursing home can't properly take care of them, don't send them back to the nursing home. In the 5 states that we found, and of course Pennsylvania being one of those 5, the governors gave an opposite order. And remember, the states regulate the nursing homes. So when the states say this, the nursing homes have to follow those guidelines. CMS doesn't regulate nursing homes. So the governor in Pennsylvania through his health department said you have to take those seniors back. So they go back to the nursing homes, and it's not just that one individual senior who in some cases was dying. They were going back and infecting large numbers, maybe 10, 15, 20 other seniors in those nursing homes. And we were seeing double-digit deaths in those nursing homes. And it was in multiple nursing homes in the state of Pennsylvania. And again, we're using, like Scott said, the governor's data. What they did was stop reporting some of the data. So for example, if a senior is forced back into a nursing home and infects 15 people that are now having symptoms, all 15 of those seniors go to the hospital. Let's say 4 of those seniors died. The governor stopped reporting that data as a nursing home death. So now you don't even know the full picture, because maybe they went back to the hospital and died there because they got infected because of the governor's flawed order at the nursing home. This is what is angering the families, is they're saying, why did you send positive COVID patients back to the nursing home to infect my grandmother or my father? And that's what angers people. They deserve those answers. Governor Wolf ought to just come clean with it. Don't try to cover this up. We're going to eventually find these answers. He ought to do this now. There are big decisions being made in Pennsylvania about what to reopen, when to reopen, how much to reopen. And part of it's based on the data. And if the data is flawed and you could tell it's isolated within nursing homes, then that helps you make better decisions for opening up the rest of the economy safely, sending kids back to school at Penn State and at other universities and high schools and middle schools safely, as opposed to shutting the whole economy down.
Indeed, indeed. Laura, do we have more questions?
Yeah, we are getting another question from David Weiner of Penn Live.
You hear me?
Yeah, we got you loud and clear, David.
Okay. Scott, I know you're well aware that the nursing home in Pennsylvania, their associations, they've talked a lot about the challenges that they've been facing. You know, they've talked a lot about testing, protective equipment, definitely like a lot about a need for more funding, more resources. I haven't actually heard them say anything about this this policy that you're talking about having a major impact on what happened in the nursing homes. So what I'm asking is, I mean, are you hearing them publicly mention this when they talk about all the problems they've been facing?
David, I will tell you this, it's my opinion based on the nursing home administrators and staff that I have spoken with. They have, the fear of God has been placed in them because they have been put on notice by the Attorney General that they could be prosecuted for murder in these cases. And in this circumstance, in this world that we live in, where right now there are no liability protections, where the government has forced them to do this and provided no help to them. I mean, I talked to a nursing home that just started testing on May 27th. They've been given no PPE. They were given no resources out of the billions of dollars that Representative Scalise and I and others in Congress sent to them. And still they're being, they're scared, I think, or at least concerned, and rightly so, that the blame for all this will be placed at their feet. And so in a circumstance like that, you got to be very, very careful what you say. So right now, I think they are really focused on making sure, and I'll just remind you as well, we received a copy of a letter that was sent to, as far as I know, kind of a letter that was sent out to all nursing homes in Pennsylvania that essentially said, if you don't comply with the reporting requirements, you will go to jail and suffer the fines for it. You personally will go to jail. I've seen a copy of that letter, and I think our office has probably sent it to you. That's the situation that they're operating under. It is not very collaborative if you're one of the nursing homes that is working on a thin margin, trying to keep your residents safe, and in this case, keep your residents alive while you have the power of the state breathing down your neck and essentially threatening you in advance and after the fact. So I think we have to be careful about how we characterize the actions of the nursing homes. They are living in a different world than I think the rest of us are because of the policies that have been put in place. And again, as you know, David, and as the whip has pointed out, they're regulated by the state. So their licensure, their ability to operate rests solely in the hands of the state regulators and the state policymakers. And if you get cross with them, it won't take much in this case to put you out of business. It's not collaborative at all, quite honestly.
Yeah, and look, there's a lot of blame game that you're starting to see played by some of these governors, you know, and I've seen some of these governors giving press conferences droning on for hours and talking about accountability and transparency. And then all of a sudden we start digging and finding this out and trying to find more answers. And then they clam up and they want to blame the nursing homes and blame everybody else, but they won't give us the data. The bottom line is just be honest about what happened. If you made a mistake, why you should explain at least why you went against the federal guidelines. 45 other governors did it. It's not a partisan game that's being played. Republican and Democrat governors got this right. 80% of nursing homes didn't have these problems, but we saw huge disparities in these 5 states where the governors decided to throw the federal guidelines in the trash can and force the nursing homes to take the patients. Now they're trying to blame the nursing homes, and the nursing homes, like Scott said, are scared to death because the state is their regulator and the state's looking to dump it on anybody. Just be honest with people. You know, you give your press conferences, you talk about transparency. Now it's time to put your money where your mouth is.
And we're seeing no new requests for questions, so we will conclude today's press conference.
Well, I want to thank you all for your interest. I hope that you will continue to report on and dig into the story. Talk to families that have had a loved one die in the nursing homes. Talk to the nursing homes, and quite honestly, I hope you will press the governor and the Secretary of Health. The simple question is what were the metric? What was the rationale that drove you to this decision? The decision and the policy that remains in place today. And why should it be different than the federal policy? Has it been effective in your viewpoint? Should it be changed? If not, why not? People, as the whip, as Steve has mentioned, in Pennsylvania, nursing homes are still dying at this moment, and the policy is still in place. I think it's incumbent that we as citizens that elect these leaders know the answers to these questions. And right now, no one's pressing them except for some in the legislature like myself. I think the state legislature has asked these questions, and the good gentleman from Louisiana's 1st District who leads the task force. So I would hope you would continue to do that so we know what the truth is throughout this whole thing so that we can do a better job in the future and make sure we don't make the same mistakes in the past. And with that, Mr. Whip, I'll allow you to close if you prefer to.
Thanks. Well, Scott, thank you for fighting for these families in Pennsylvania who lost loved ones and deserve answers. We're going to keep fighting to get those answers. And I wish the governors would just be honest and candid and show us and be transparent about the numbers and what really happened, because these are people's grandparents and parents, and they deserve to have those answers. We're not going to stop fighting until we get them. Appreciate working with you on this, Scott. And God bless those families in Pennsylvania who lost loved ones. Unfortunately, these thousands of these deaths should not have happened.
That's right. That's right. Well, thank you very much, all. Have a great and safe afternoon. God bless you.
Thank you. God bless.